I will start with the topic of how to be satisfied with your body image. There are certain points for a woman. Let's talk about the woman here. The woman has to put in mind with regards to her body image. She is supposed to like her body and to love her skin. And this comes in her way of living. So if she's really caring about her image, then the image reflects the following: the proper diet, the proper activity and exercise, proper hydration of the skin and care of the skin hygiene, and even acceptance of certain defaults in her body and accommodate her clothing to cover those areas and to show the best of her body, putting in mind nobody's perfect. On the other hand is the psychology of the person. She has to be confident enough because she's doing all the required measures in her life to keep up her body. So she is not supposed to be imitating a person and only comparing herself with whatever picture of a model that she sees over social medias and the internet. These are really influential and they are really fake because they're mostly photoshopped. The third part is that comes from her confidence in herself, is the reflection of the society around her on her. Means the husband, the partner, the family, the close friends, how they look and how they actually express their opinion to her, especially the husband. Now, if the husband is not supportive or criticizing and he is very important to her, so she will always feel insecure and she will seek the advice to change her figure or to change her body. Now, changing the figure or fixing up any problems in the figure, of course, can be done in a very fantastic way through cosmetic surgery, but it needs also to have the perfect surgeon, the perfect patient, and the perfect problem. Now, the patient is having a genuine problem, and of course here we can take like one by one, and in my blog I'm going to talk about each and every problem and I will say a small story behind it. Today it's like in general, if the patient is really having a problem, the surgeon, like I am, would analyze the problem and see if the patient is really having a problem cosmetically, then and the surgeon, I have the solution. This is a perfect match, provided that the patient is talking about a genuine problem and she is psychologically, socially, financially, and mentally stable. In this case, we go ahead with a solution. Sometimes if the patient comes with a genuine problem, but it has no solution, then I will not feel good that I can't help her, but probably I can help her by referring her to the more specialized surgeons or doctors in another specialty. But sometimes if the patient comes with no problem and asks me to solve it for her, which I find it not a problem, in this case, I think these kind of people need to have a psychological therapy. And I emphasize always to the patients that they have to be really prepared for the cosmetic surgery socially. Like, she is not supposed to go into surgery and she has so many social commitments, or she has nobody to take care of her house or children the time she will go for the surgery, or she has no vacation allowed, or she just started to work. I mean, these social issues has to be handled by the patient before she comes for the surgery. Second thing, psychologically, if she's scared of doing surgery or she is like psychologically disturbed and she has problems at home that prevents her from accepting the idea behind the surgery, she better not do it until she feels like psychologically she is calm and stable. Financially, I mean, there is an issue here. It's a cosmetic surgery and you don't do it unless you're ready for it, because it's like part of the luxury of the life. And so if she's ready financially, she is supposed to go for it. If not, I don't think she needs to have the burden of having loans in order to do cosmetic surgery, because she never know, maybe she has the perfect results, maybe not. Now, so if these three things happen, or you find this stability in the patient, for us as surgeons, this is the perfect triangle in the patient. The other thing I want to say, patients or people need to, they're not supposed to have to follow other icons or people in the media. Avoid imitation. Be yourself. Love yourself the way you are, with some moderation or alteration in their body or the face. That's in general. These are certain ethics. And also, from the surgeon point of view, the surgeon, I think, is supposed to give the honest opinion and never look at the patient as she is a money source, and never feel like his or her patients are the source of paying their bills. Plastic surgery is, at the end of the day, is a medical field, surgical field, needs to have honesty in the surgeon. This is general speaking about cosmetic surgery ethics. I'll be talking about it once in a while, especially if I face some stories to be mentioned. But from today on, afterwards, I will be talking about each and every procedure. What is the pros and cons? What are the ages that patients needs to see plastic surgeon for? What's the new trend? What's the FDA approvals? So on and so forth.